The coronavirus pandemic has fueled another crisis, an alarming surge in eating disorders, especially among adolescents. The National Eating Disorders Association reported a more than 58% increase in calls, texts, and social media contacts to its helplines from adults and adolescents since the pandemic started. More than a third of those are from teenagers between just 13 and 17 years old. Center for Discovery, which operates 15 adolescent clinics for eating disorders, reported more than double the demand for its residential facilities in 2021 compared to 2019. CBS News chief medical correspondent Dr. Jon LaPook spoke to one of their counselors, Elizabeth Masoko. She's dealt with her own eating disorder since she was in her 20s. Masoko told us she hasn't seen an empty bed at the clinic since the pandemic started.
When you are maybe feeling sad or isolated, it's kind of those moments where it can creep in. And so I think that, quarantine has definitely taken a toll on people.
Dr. Jon LaPook joins us now. Dr. LaPook, good morning. Good morning. So we just heard Elizabeth talk about how isolation is contributing to this trend. What else is happening, especially during the pandemic, that's leading to this surge?
Well, this pandemic has been so destabilizing for so many of us, right? But especially for people who have mental illnesses, and that includes people with eating disorders. You have increased anxiety, a loss of your normal routine, your regimen of your day, and a sense of being out of control, right? I mean, we can't control COVID, but you can have the illusion of control of what you're eating.
Until you said it, I never thought of an eating disorder as a mental illness.
Yeah. Well,
how so?
Yeah, there's a lot of research into this. It's a combination probably of underlying tendencies like anxiety and depression, obsessive compulsive disorder, but also genetic factors and brain wiring. This tremendous area of research into this, but it's so important for people to understand that it's something that they can do something about. There's so much stigma with mental illness, and that's one of the reasons why we want to say, yes, this is a form of mental illness, but there's lots you can do if you recognize it. Well, for example, early recognition, we understand with adolescents, there's family-based therapy now, where it's all together, the parents are agents of change, and it really matters if you diagnose this early. And that's one of the things that was so interesting for me. We spoke to therapists and psychiatrists and families and patients themselves, and there was a 16-year-old girl who, 100 pounds and 5 feet, and at the age of 14, she suddenly started to lose weight. She went down to 85 pounds.
Yeah.
She had a good enough relationship with her mom that she said, Mama, I think there's something wrong with me. And because of that, she was able to get into therapy, family, actually residential, and then inpatient, outpatient, and she was okay for a while. And then you know what hit? The pandemic.
Yeah.
And the pandemic destabilized.
We saw a graphic before that said what to be aware of. If you're a parent, what do you look out for here?
Well, you want to look out for change in your body image, your unhealthy relationship with food, looking in the body. This 16-year-old who, when the pandemic hit, it happened again and she lost another 15 pounds. She said she would look in the mirror, and even though she was 85 pounds, she would say, oh, I'm fat. Yeah. So unhealthy relationship with food, unhealthy relationship with your body. Maybe they're going up to their room to eat their meals. They're being secretive. She told me that she would hide her food. And then she would binge, and she, so she was wearing baggy clothes at home, so she wasn't with her normal peer group. Her parents weren't noticing, and finally they noticed again, and they got her back into therapy.
And Dr. LaPook, quickly, are these new cases, the majority of them, or are they people who have struggled with this who are relapsing?
I spoke to a therapist about that. He said it's a combination of both. So in the case of the 16-year-old, she had this problem, she relapsed. In the case of a 14-year-old boy who started at 13 to lose weight, he had been bullied as a kid, he was overweight, everybody teased him, so he started to lose weight. Well, he lost like 30, 40 pounds. And his parents were thinking, great.
Yeah.
But then he went too far, and the father, who was so guilty when I spoke with him, he said, I'm an educated man and I have a graduate degree, and why didn't I notice this? Well, guess what? Boys and girls can both have eating disorders, and I think just the awareness of it is so important. And I was very grateful to these families for talking to me and to really being so honest.
You're bringing that awareness, Dr. LaPook. Thank you so much. Such an important topic. If you or someone you know needs help with an eating disorder, you can text or call the National Eating Disorders Association hotline at 1-800-931-2237. The association supports both individuals and families affected by eating disorders. We'll be right back.